My name is Dr. Veronica Ajewale. I am the Director for the Community Engagement Core of the Center for Biomedical and Minority Health Research here at Texas Southern University. And we want to say a big thank you for joining us for today's program. We are sure that you have had a lot of great information that we are going to use together as a community as we work alongside each of us in advancing health equity. Please complete our survey, engage with our vendors, engage with our exhibitors, and do not forget to continue to follow us on all our social media handles. You can find us on social media pages at CEC Southern U. We hope that you have an incredible time engaging with us for the rest of today's program, and we hope to see you at our upcoming events. Thank you for joining us, and we look forward to seeing you again.
All right. Good morning, everyone. Can you guys hear me just fine? Good, good. How's everybody doing today? Awesome. My name is Virgil Elkins. I'm the project manager for Texas Southern Center for Biomedical and Minority Health Research. And we welcome you today to our TSU Community Engagement Core autoimmune disease focus on lupus. So we have a lot of great information here for you, a guest speaker. Then also, after the event today, I want you guys to take a look at our tables to pick up more information in regards to our program. So going over the agenda today, there'll be a Q&A session that will be after the guest speaker today. And then also, if you have any questions for our online attendees, if you have any questions, please post those in the chat box and we'll have someone working on that as well. So we do ask during the presentation, you hold your questions until the speaker is finished and then we'll go there. We want to give a thank you to Houston Health Department here at the 3rd Ward Multi-Service Center. They were so gracious enough to allow us to use the space. So we thank them for allowing us to use it. And then also, Ms. Wright, she stepped out, but she'll be back in. But I want to say thank you to her because she's working with us to get this program going. The Center for Biomedical and Minority Health Research, our goal is to bring forth awareness about the health disparities in the African American community. It's very, very important that, we take care of our health, look after our family members who may have health issues as well as ourselves. And so what we do is every month we host community events around the city of Houston, sometimes at a faith-based organization such as a church or at community centers such as this to bring forward health education seminars. I want to say special thank you to our sponsors, Aflac, Walmart, and Aetna. And then also, before we get started, for our people online, if you would go to Linktree for our CHWs to sign in on Linktree. Then also for our people online, there's an evaluation and a survey sheet that you'll fill out. And then for our guests in attendance here today at our CBMHR table, you can fill out a survey as well to let us know how did our program go today. Okay. So I'll read a little bit about our guest speaker today. Dr. Damian Fisher, he's a PharmD, a pharmacist, clinical pharmacist from University of Texas Medical Branch. He graduated from the Florida A&M University College of Pharmacy with a Doctorate of Pharmacy degree in 2004. He prolonged his studies and completed an ASHP accredited residency with an emphasis on community and ambulatory care at University of Tennessee. He became intrigued in academia, and during his career, he has held 3 clinical assistant professor positions at Hampton University School of Pharmacy and University of Houston College of Pharmacy, as well as South University School of Pharmacy. His passion in the ambulatory care world is within the areas of pulmonary and dermatology. He's currently certified as an asthma educator and is heavily involved with the American Lung Association, also known as ALA, as a national presenter. He serves as a board member to the National Association of Certified Asthma Educator Board, advocating for asthma educator opportunities. Dr. Damian Fisher currently works for UTMB Health League City Team as an outpatient allergy dermatology clinical pharmacy specialist. Above all, Dr. Damian in his spare time is an avid moviegoer, watches all types of movies, and even goes as far as critiquing them. Without further ado, everyone, I welcome Dr. Damian Fisher.
How's everybody doing? Before I speak, I also like to tell people 3 things about myself to let everyone know I'm a regular guy or let them know that I'm unique. Let's see. I wear a size 21 shoe. I get it from my grandfather. He wore a size 20. Going to Florida A&M for $10,000 a year because of my size 21 shoe. And let's see, my daughter is 13 and she just asked me yesterday if she can go out on a date. I said no. So this disease state's pretty special to me. I've been in dermatology and pulmonology for clinical pharmacist. So we do run into patients with psoriasis, atopic dermatitis, and lupus. And I just know someone, or if you do have lupus, where you can actually get financial aid. You can also get grants. You can also find out information for medications as well. And I will gladly give you my email as well as my cell phone number if you ever need my assistance trying to get you to for medication assistance. Okay. So lupus, unraveling the mysteries of the butterfly effect. And the butterfly effect that's coming into basically, other than those that actually saw the movie, is more going into the rash that can actually go across the nose. Now, that is not heavily prevalent among patients with high melanin or patients that have darker pigmentation, but it is one of those key signs of lupus. Matter of fact, that key clinical presentation of the butterfly rash doesn't show up all the time. So what is lupus? Lupus is basically an autoimmune disease, right? It is an autoimmune disease that can be caused by different things. It can be caused by a virus, it can be caused by medication, and it also can be caused by overexposure to sunlight. It can also be caused by someone having some type of immune reaction or things like that. But mainly what it is your body trying to fight off, itself. And when it tries to fight itself, it's attacking your normal cells, where it can affect your joints and affect your skin condition. Now, when we're talking about your skin condition, people usually get these like blood-like rashes on top of their skin, where you see it's really red at the top, where again your body's trying to fight those proteins from your cells coming from your skin. Other symptoms are more geared to pain, swelling joints, feeling tired all the time, headaches, also sensitivity to light. Now, I can't stress enough about the sensitivity to light. The sensitivity of light can be very annoying, and some medications can actually potentiate those sensitivity to light. So if you ever are on a group of medications and you're worried about that, please check with your pharmacist, or you can check with me. But there's a list of medications that can actually cause or exacerbate lupus-like symptoms, and there's a list of medications that actually cause you to be more sensitive to light. One of those medications are clindamycin, erythromycin, things of that sort. So, it's always good to know what medications you're on if you do have this disease state. It can involve multiple organs. One is definitely the skin. The other one is actually the kidneys. That's why it's imperative, especially as African Americans, to always get your kidney function checked if you do have lupus every 3, 6, or 12 months. Because your body can actually when you do have lupus, you actually have your kidneys inflamed. Now, some of us, because of these pain in joints, we want to take those type of medications to relieve those. Of how far we've come, we've actually seen people have a good quality of life after 45, almost to the ages of 60 and 70, because we're able to control those flare-ups. Now, when you do have a flare-up, you're trying to control that type of pain. You're trying to control the pain in your joints. You're trying to control the pain on your skin. And what you want to do is try to make sure you're talking to a specialist. Your primary care provider should not be your specialist. And I'm sorry to say, they can actually help you monitor by ordering labs, but you really do need to get into some type of specialist, someone that's actually seen lupus. I'm not saying them seeing them every 3 to 6, 12 months. I'm saying at least seeing them once a year. Now, our clinical presentation of lupus, the major thing that you do see, again, is that joint pain and stiffness. Now, how do you differentiate that between arthritis? Well, people always say with lupus, you're not only going to get that joint stiffness at the joint areas, but rashes throughout the body and on the trunk. They're going to become very red. They're not going to become plaque-like, but they're going to be very red in nature. Usually they're flat. You can also get that butterfly rash, of course, over the bridge of the nose. That's what's called the butterfly rash. Again, it's very hard, not very hard. The incidence of the butterfly rash with people with a lot of melanin or African Americans or people with dark pigmentation is very low, but it can still happen. It's frequently usually seen in people with full-blown lupus. And what we try to do, what you think about when you do have lupus or when you have this joint pain, lupus is not the first thing that comes to mind, right? Has anyone ever seen House, MD? No? I love House. Not because of the guy being a jerk, because he is a jerk. It's basically because they're basically a diagnostic team. And it's like every third show, the diagnosis someone always brings up is lupus. No matter what. It's like, is it lupus? Because lupus can be characterized because of all the symptoms it's had. The joint stiffness, the pain, the skin reaction. So everyone always thinks, or the kidney issues. Everyone always thinks it's some type of lupus issue. So we need to be diligent only as patients and providers in actually in asking yourself what else is going on with your body. If it's just joint issues, maybe it's not lupus. Again, lupus is characterized by an autoimmune disease. It can affect multiple different things. Skin and the kidneys is definitely those two type of things. And also, you also see some type of weight loss as well, and the sensitivity to light. And I cannot stress that enough as having that sensitivity to light. And about patients that go uncontrolled for lupus, one of the major things is you get the inflammation of the kidneys. So you also can look at lupus as more affecting other issues. They can affect, over long term, it can affect your breathing. You definitely can see ulcers in the mouth. Okay, they come and they go, and they come and they go, and people also experience hair loss. Now, hair loss is something that usually comes when it goes uncontrolled for a period of time, and there's a flare-up. Okay, and I'm not talking about just regular alopecia. I'm just talking about thinning of the hair. Basically, you're starting to lose hair more rapidly than as you get more mature. My mom always told me never call anyone old, just call them mature. Okay, so as you get more and more mature, you want to make sure your hair loss is not being lost rapidly. You're actually losing hair as you get more and more mature. Muscle bone pain arthritis is one of those key signs, and then anemia. Does anybody know what anemia is? Has your doctor ever say, yo, you need to take an iron tablet or a folic acid tablet? Okay, so basically what that is that basically your red blood cells need iron, okay? They need iron in order to develop, okay? They need iron in order to circulate, or they need folic acid, okay? Unfortunately, with lupus, you actually get two different types of forms. You could possibly get two different types of form of anemia. Now, you can't just fix it with iron or folic acid, but lupus itself can cause two different types of form of anemia. Lastly, lupus can actually have issues with hypertension, therefore leading to heart disease. Now, I know that none of us like always taking medication, but unfortunately with lupus, you're going to be on 2 or 3 or even 4 medications. All right. Now, once we get it under control, those 3 or 4 medications can drop down to 2, but you do need something to maintain you, and we'll go over that real quick. So now we talked about what is actually lupus. Now, how do we get to actual diagnosis of lupus? Well, I think the first thing that we need to do is, if your primary care provider, the person you've gone to for years, they think that you do have lupus, I just wouldn't go off their word. I'm not saying your primary care provider is not smart. That is not what I'm saying. All I'm saying is you probably need someone that sees lupus patients on a regular, because the disease state and how we treat it is changing. We used to, when I graduated back in my day, we only had 2 or 3 drugs, all right, plus steroids. That's all we had. Now we have 4 or 5 drugs, and now those 4 or 5 drugs, because of the product formulation, there's less side effects as well, okay? Now, not all primary care providers are up to date on that. Again, not talking about your primary care provider, they're not smart. All I'm saying is a rheumatologist or someone that sees lupus patients, that's the person you probably want to see at least once a year. Now, that diagnosis can be done by a couple different things. There are questionnaires that you can do that can support your diagnosis. Of course, there's a kidney biopsy to check to see if you actually do have lupus. There are blood tests you can do to check for antibodies. There are anti-phospholipid antibodies that you can do. So if you ever get on your lab test, you see ANA, they're looking for antibodies to see if you do have lupus. They also can look for protein in the urine, possible blood in the urine, and decreased GFR. Now, the GFR is just a fancy way of looking at basically your kidney function. Okay, just a fancy way of, you ever see GFR in your lab? It just means kidney function, all right? You want your kidney function, if you're of a certain age, of a certain mature age, of over 60, you at least want your kidney function over 60, okay? So you're always looking for how well your kidneys are doing. You're looking for your serum creatinine and also words like GFR. Those are telling you what your kidney function is, okay? This is a very detailed way of how they basically diagnose, from a questionnaire, how they diagnose lupus, right? So they diagnose lupus by classifying basically these points on whether or not do you have any issues with your heart. So with heart, you can actually have inflammation around the heart because this is an autoimmune disease. Do you have any hair loss? Do you have any issues with, do you have any antibodies of it? Or do you have any protein in your urine? They calculate these points, and if all these points are greater than 10, that characterizes that you have lupus. Now, this is just a questionnaire, and they do it off your labs, and they also do it off your clinical presentation or how you look or your signs and symptoms. And they look at all those things and basically, they calculate by looking at all those things if you have greater than 10 points. Lastly, what they look at specifically is your CBC, which is your complete blood count, and they're looking at that for any type of anemia. Your BUN, creatinine, they're just looking at for your kidney involvement. They also will ask you to do a urine test, and they're just checking to see if you have any blood in the urine. If you have blood in the urine, that usually means there's some inflammation or your kidneys are not working as well. Your kidneys are a filtering system, okay? So when your kidneys are filtering real well, there should only be some type of uric acid within that is being excreted. Now, if there's something else that's going along in the urine, that means that your kidneys are not working properly. There's other tests that check for inflammation, such as creatinine, the erythrocyte sedimentation rate test. That checks for inflammation, but again, those tests are not very specific. This test right here, the anti-phospholipid antibodies, that is your go-to. That is your, whether or not you have lupus or not. So now we went over the diagnosis, the signs and symptoms. What can we do to actually help our patients to get medication and also to get money and also to pay for certain labs? Well, the first thing I would like to say, the first thing you can do is there is a lupus awareness grant of financial need that you can get $500 every year. That can really help you with your medications. Now, I know it's only $500, but you can keep reapplying every year as long as you show financial need. And you don't have to show like 400% under the poverty level. You just have to show financial need to cover your medications. And that grant is reusable every year, as long as you have a doctor signing off on that diagnosis. And if anyone needs help filling out that paperwork, I've done it several times for my patients. I have no issue helping anyone with that. There's also other resources such as Cover My Meds. Now, Cover My Meds is a great way to find out whether or not your drugs are covered by what insurance. In case you always have that question, it's a website called Cover My Meds. I use that all the time for my patients. It's an easier way for me to find out if the drug that's being prescribed by the provider, by your doctor, whether or not your insurance is going to cover it or not. Now, why is that helpful? Well, it's helpful to you because who wants to go into Walgreens and then go to CVS and then go to Costco and then go to Kroger? You're trying to find the best deal. I totally get that. But first of all, let's find out if the drug is covered under your insurance. Okay? Let's not have you jump around so many times and waste your time. And that's one thing I don't want my patients to do. I mean, there's a lot of other things in their life they have to do for themselves. So if I can find any way to shorten that gap where they don't have to spend that time jumping around to see whether a drug is covered, I'm going to do that for my patients. Funding and research. So there are actually grants and also scholarships you can get for lab workup. I don't know if you guys pay a lot for your labs. There's Quest Diagnostic actually has a grant and a scholarship that you can actually submit, and whether or not you can get your labs paid for in case you don't have insurance, or in case you are in the donut hole of your Medicare Part D. They have some type of scholarship you can actually request for them to take care of some of your labs. Your labs can be very cumbersome. I totally get that, especially if I'm telling you you should check your kidney function at least 3 to 6 months every year. We're also for the diagnosing of your labs. Not everyone's going to be checking for their anti-phospholipid antibodies. That can be a very costly test as well. You also want to look at education and support, provide education. If you go to the Lupus Alliance Network, that has a lot of that has a lot of education for our patients. And it breaks down a lot of complex medical jargon easy for patients' comprehension. No one likes how any medical professional talks over a patient and says big words. You know, that's not fair to you. You need to be able to understand what's going on with your body, all right? You know, sometimes you just need to break it down. Anybody ever watch the movie Philadelphia, Denzel Washington? No? I'm a big movie person. All right, anyway, there's a quote he says in there, talk to me like I'm a 5-year-old. He's a lawyer, and he's like, just tell me like I'm a 5-year-old. And it's the same way, I don't want to talk down to my patient, but I want my patient to understand. I at least want them to leave the room saying, I got what he's saying, now what can I do? All right? So basically, at most, we should find ways in order to give you guys education. And the Lupus Alliance Network does a great job. That website does a great job breaking down concepts, medication, what patients' testimonies, patients that may look like you testimonies. That's one reason why I like the website. They go over their trials and tribulations, and you may feel some type of way because basically you have someone out there feeling the way you are, and maybe you can read their story and see what they did or how they came to a resolution. I lost the clicker. How's that possible? Oh, sorry. Here we go. All right. Oops. And then lastly, the Lupus Foundation of America is another great website of managing your fatigue, preventing your infections, because unfortunately with lupus, your body's attacking itself. You're more prone to getting infections, especially pulmonary infections and infections that are happening on the skin. So you want to make sure you're diligent in understanding what type of infections are you more prone to. And again, I can't say this enough, you are going to be very sensitive to light. You can actually, too much light or too much ultraviolet light can actually cause some type of reaction to your skin. Now, questions you should ask your doctor regarding lupus. These are really good questions, I think, that could actually show that you get a better understanding of your condition of lupus. So what typical symptoms of lupus do you see? Because the typical symptoms of lupus can definitely cause a change of quality of life. How do I make sure I have lupus and I don't have arthritis or any other condition? What are my diagnostic tests? I think that's very important, because who wants to read a whole page of labs and you're not understanding what's going on? All right, they should underline it, highlight, like this means this means that. And if any time, you guys want to send me like a shot or something, I do it with my other patients, just tell you, well, he's talking about this is your kidney function, or this is your red blood cell count. Okay. Oh, yes, I know it says that this is abnormal, but it's only 0.1 abnormal, so it really doesn't mean that you're abnormal. It just means you're out of that range just a tad bit. So, there are things that you could be, not deadly scared, but things that you could be scared about that you don't really have to be. So going over labs is very important, I believe, in order to bring some type of calm to the patient. Are there any lifestyle changes? How is my self-care? So SPF 70 is something that you're going to have to go ahead and put on when you do have lupus, right? The sunlight protection, you're definitely going to need that as a self-care. How often should I expect flare-ups? What can trigger them? Any type of infection can trigger your flare-ups. Any type of trauma can cause your up. Medications can cause your flare-ups. Over-the-counter medications can cause your flare-ups. NSAIDs, ibuprofen, those things. Are there other medications that can cause flare-ups? Are like things like I think it's procainamide. There's a drug for your blood pressure called hydralazine. It's called hydralazine. It's a vasodilator. It can actually cause lupus-like flare-ups as well. Potential long-term complications or risks are associated with lupus. That's a good question, because sometimes people actually, because of the arthritis in their hands, they lose their dexterity, they lose their grip. They also have issues rotating their wrist, bending their knees. How do I prevent that? What can I do? Are there any exercises? There are plenty of exercises on those networks, on those websites that you should go to. How frequently should I follow up with you for monitoring and adjustment for my treatment plan? That's very important, because you don't want to see the doctor every week. You don't want to see the doctor every month. You don't want to see the doctor every 3 months. So how important it is for me to come in to see you to make sure my care is optimal. Now, these are the common medications that are usually used for lupus. The big one that everyone should take away with is Plaquenil, hydroxychloroquine. People heard about that, especially during COVID, but that was the mainstay treatment for lupus. But one of the key signs with this drug is you have to do a retinal test every year while you're on this medication, or at least before you take this medication. If you don't do it, this drug can actually build up and attach itself to the retina, causing some toxicity. When that does that, you could start getting issues with your vision. So, before you take this drug, the first thing you need to do is an eye exam. If you do not do an eye exam, you should not be taking this drug. Okay? That's the first thing. And I'm not trying to scare you. That's not my tactic here. The thing about Plaquenil is it's one of the key things that you want to do, because it can attach itself to the retina. Now, if you've already been taking it and you had no issues, then there should be no issues going further. But before you're getting prescribed this drug, the first thing any pharmacist or any provider should do is make sure you have a retina test, because the drug can actually bind to the retina, the little molecules. Some of the side effects with this drug, it can actually cause worsening of, not worsening, it can actually cause hair discoloration. So I've had a lot of my patients actually on hydroxychloroquine for 5 years, and they actually, they had a full head of hair that was black, and then after 5 years, their hair starts to become gray. And we're talking about 45-year-olds, but they were just like, well, I didn't think it would speed up this fast. I was like, remember I told you it would cause some hair discoloration? He's like, yes, I do remember. So just be mindful of that. So there's nothing going on with you. It could be just the drug. And it's always good to be upfront with your patient to make sure they know everything that's going on with your drug. Steroids. Steroids, long term, is always bad for any individual. Short term, it can control the flare up. I totally agree. But long term, you should not be on steroids for longer than 14 to 30 days. Okay? And when I'm talking about steroids, I'm talking about oral steroids. Oral steroids can definitely cause increased blood sugar, which is the biggest issue. All right? Can actually cause people to have uncontrolled blood sugar, leading to diabetes. So that's the reason why we don't want patients on steroids for long periods of time. Steroids decreases inflammation. When it decreases inflammation, it causes immunosuppression, therefore making you more prone to having an infection. All right? There's other drugs out there, immunosuppressants like methotrexate. Methotrexate is a really good drug. You do have to take it with folic acid, but it can cause major diarrhea and ulcers in the mouth. These are key things that you should know, because once you get on these drugs, these are your maintenance medications to treat lupus. Your maintenance medication. So what do I mean by that? It decreases the inflammation to suppress any flare-ups that could happen. So if you're not on this and you're only treating your flare-ups, you're just putting a Band-Aid over your condition. If you're on these medications, you're not putting a Band-Aid, you're suppressing, and you're actually decreasing the incidence of flare-ups. You don't want flare-ups to happen all the time, because over time, more and more flare-ups you have, the more and more damage to your kidneys. Lastly, one of the drugs I definitely want to talk about, this is the new hotness, safanalo. Safanalo is a new biologic that just came out. The great thing about this drug is there is a prescription assistance program, and it's actually been shown to actually starting to reverse, sorry, I shouldn't say reverse, to suppress the actual protein and inflammation that causes lupus. So this drug has actually been showing a lot of turnaround for those patients that do have lupus, and especially our African American patients. The problem is it's very expensive. But there is a prescription assistance program where you can get the drug for $0 to $10 every time you get the shot or the IV. The problem is that you have to go to an infusion center to get the medication every 4 weeks. And I know that's taxing, I know that's tiring, but it really has shown a lot of promise in our population in treating our patients with lupus. One of the major issues that we do have with this drug is it may cause urinary tract infection, especially in women. There's a high incidence of that. We do have to do a TB test for our patients before they take this medication. Insurances is going to want you to do a TB test, which is a blood test. There's no more of that test where they stick the needle underneath your skin and they see how big that little dot is. We don't do that no more. We just do the blood test. It's called a quantum interferon test. And what that is just checking whether or not if you have tuberculosis. But every year you're on this drug, you're going to have to get a TB test in order to make sure you can continue taking this drug, because this drug can cause tuberculosis. You just got to make sure that you actually check yourself. That's all. Because we don't want to give you a drug that you already have tuberculosis. That doesn't make any sense. That's the reason why we always need to make sure that you don't have it before every year. That's why the insurances are so hard on any provider. If you order this drug, you must make sure you order a tuberculosis test every year. So medications, what monitoring parameters we need to do? We always need to check your sugars. We need to do a bone mineral density test, looking for osteoporosis, DEXA scan test. We also, for oral steroids, we need to do a cholesterol every 3 to 6 months. So these are labs that you should be aware of going forward. As I said, with cause you to have floaters. It can cause your peripheral vision to shorten. So you want to make sure that that when you're getting prescribed this medication, that you do have an eye examination every year. Blood tests, you want to check for complete blood count, your red blood cells and things of that sort, because we don't want you to have any GI bleeding, and we also don't want you to use chronic NSAIDs to treat your flare-ups or your pain in your joints. And lastly, if you're on methotrexate, we definitely need to always check your blood, and we also need to check your kidney function every 3 months. So every 3 months while you're on methotrexate, you're going to have to get labs done. So the ABCs and advice tips for support and caretakers. You want to know where to find resources. There is, as I said, Lupus Foundation of America is a great resource. Also, the Lupus Alliance is a great resource. Know your symptoms, and if you are a caregiver, know your symptoms of your loved ones. Everybody's body is different. Some people may have more symptoms of joint pain. Some people may have more symptoms of hair loss. Some people may have more issues with photosensitivity, having a reaction to light, or some people may actually have more mouth ulcers going on as well. So you want to make sure you know your person, know your patient. Ongoing fever, swollen, painful joints. Now the fever, it can be intermittent. The problem with lupus is because your body gets attacked, you're more prone to infection, and what does your body do? Your body tries to basically increase its body temperature to fight off any type of pathogens or bacteria. But the problem is your body's always having that uncontrolled fever and then not fever, fever and not fever. And your body can't always deal with that all the time. So sometimes your body gets very fatigued and tired. All right? Be open. What I can tell you now, there are 3 or 4 drugs down the pipeline that are considered cures. Sorry, I don't want to say cures. That are considered revolutionary for the treatment of lupus. So be open to new adjustments, new treatment options. You also want to be able to communicate. Tell your patient, tell your loved ones, tell your brother, your sister, how you're feeling, because everyone wants to know how you're feeling with lupus, because lupus is something that can change day by day. All right? Lupus is something that can change with new drug treatment. So there's going to be certain ways, certain things that you're going to feel that can only be conveyed by you. And no one should be able to assume how you're feeling just because you do have lupus. Doctor visits and dates. I always tell my patients to keep some type of log, some type of scheduling. So they're making sure that, all right, on this day I got my labs, on this day I'm seeing my doctor, on this day I got a televisit I want to see on the computer, this day I'm actually doing some type of eye exam, this day I'm checking whether or not my blood sugar is controlled. So you always want to keep some type of log or some type of reminder, or have a friend or a caregiver to keep those reminders. Set it to your phone, let your phone go off, let your phone be your reminder. Always express your concerns to your healthcare provider. I always make sure that it's something that I always let my patients know when I see them. How you feeling? Simple as that. Is there any issues? How's your quality of life? You're not able to walk up the stairs anymore? Well, what's going on? Did you change your lifestyle? Did you move in with someone else? Those things are important. So I do appreciate you guys listening to me. I really, really hope that you have questions, concerns, reservations. I really believe that clinical pharmacists can be an asset to you, and I hope that these resources and me talking today gave you some motivation and to ask questions, and also to care about lupus if you do, or if you have a loved one that has lupus. So thank you so much. Yes, ma'am. Uh-huh.
We don't, but
Great question. So I can tell you this is that
send it to him.
what I see in my patients, that if I have a young adult that does have lupus, and I'm talking about that 18-25 range, their concerns are, am I going to pass this on to my child, right? The probability is there, I'm not going to lie. It is. But what they can do now, they can do gene testing, which does cost $180 if it does pass on. I don't know if we're there as a society to manipulate the gene while the baby's in the embryo, but I do know you can find out whether or not that offspring is going to have that trait. Also, I tell them this. 25 years ago, we were looking at lupus as causing kidney failure, and there's going to be something happening to you between 50 and 60. We're not looking at it now. Now, because of these newer biologics, and that's that last drug I showed you, and now the newer drugs that are down the pipeline, we're seeing patients live a long, healthier life with minimal flare-ups. And people with lupus are more concerned about the flare-ups, because when the flare-ups come, you're just like, yo, back up off me. I don't want you to talk to me. I want you to leave me alone. I got pain. Everything in my body hurts. We're trying to minimize those flare-ups, because that right there can cause depression. That right there can cause mental changes. That right there affects your quality of life. We don't want that. So I really tell them, as we progress as a society, I really think what you're going to see is that these medications are going to cause long-lasting changes where the quality of life is a lot better. Also, what I see is these drugs, these biologics, there's a lot of prescription assistance for them, and people are just, it's untapped. And the thing about it is, people don't want to go wait the 6 to 8 weeks to get on these drugs. But it's 6 to 8 weeks versus you being in pain. That's just my point. Yes, ma'am. Yeah, so when they say anemia, they're just talking about like your kidneys. Your kidneys produce about 20% of your red blood cells in your whole body, right? What they're saying with anemia is just the lower production of your red blood cells. If you don't have a lot of red blood cells circulating, there's a lot of things that can happen. Lack of oxygen, because our red blood cells carry oxygen to our organs, okay? Our red blood cells carry nutrients, proteins, things of that sort. So if you have a lack in red blood cells, like anemia, you're not getting the certain nutrients or your certain blood flow like you should be getting to the rest of the body. Now, there are there's 3 or 4 different types of anemia. You have microcytic anemia, and I'm just saying these words out, just going through my head. Microcytic, macrocytic, and pernicious, right? So these type of anemia is basically looking at the formation of the red blood cells. So sickle cell anemia, right? It looks like kind of like a C, right? And then you have other anemia where the red blood cells doesn't mature. You have other anemia where the red blood cells are really small. So basically what I'm saying is when you do have lupus, this type of anemia is the lack of production of red blood cells coming from the kidney. We all need blood to circulate throughout the body, right? If we don't have blood to circulate throughout the body, and that blood is carried with red blood cells, okay? Red blood cells carry oxygen, they carry iron, they carry nutrients, they carry protein. What lupus does, because your body's inflamed and immunosuppressed, unfortunately, it causes inflammation to your kidneys. When causing inflammation to your kidneys like, oh, I want to start to shut down. When it starts shutting down, it stops producing the production of red blood cells, causing that lack of blood flow throughout the body. Is that better? Okay, cool. Great question. Now, dialysis is a down the road, a very long way. Because if you look at lupus, when you have those flare-ups, usually your kidneys are inflamed. Now, the problem is your kidneys go inflamed for long periods of time, or it keeps going. Yes, your kidney function can decrease, and you may not be able to rebound up. In most cases, when you do have flare-ups and you treat the flare-ups, your kidney function raises back up. Now, over time, as you get more and more mature, that may not be something that is always accessible to you because your body's getting older. So, I would never say all my patients that do have lupus that are over 65, none of them are on dialysis. Yes, but it is possible you could go on dialysis, but we're also talking about patients' other comorbidities like hypertension, like they're having other issues like diabetes. All those other things are on top of lupus. It is possible you can have dialysis. But just because you have lupus does not mean, and as you get older, does not mean you're going to have dialysis. Great question. Yes, ma'am. Absolutely. Your primary doctor can order the labs. All I was saying was with treatment, I think you should see a specialist at least once a year for treating the lupus. But your primary care doctor can order that anti-phospholipid lab. It can order all those labs that I showed on that one screen, without a doubt. And he can diagnose it, but I think you should be seen by a specialist at least once a year for treatment. That's all. Because it's expensive for specialists. For anybody, see a specialist. So are we saying that you're already diagnosed, or are we saying that you're just preventive? No. It's best to see a specialist if you already have a diagnosis of lupus. I wouldn't suggest anyone to see a specialist that does not have a diagnosis of lupus. Yes, ma'am. I like that plug. Any other questions? Again, I really do appreciate it, guys. And if you have any questions going further, let me know. Thanks, man. I hope it went well. All right. Oh, no problem. Thank you. No problem. Thank you.
All right. You guys hear me okay? So again, thank you for joining us. This was a very, very informative presentation today, and I hope you guys really enjoyed it. Just to give you a little insight on more programs to come up, and these are the type of programs we'll put on. They're health education seminars, and again, this is for the community to take in and understand and definitely utilize the resources that are available to them. One of the things that I want to do is do a frequently asked question sheet or just a fact sheet, because there was a lot of information presented to you guys today, and I want to make sure that we're able to disseminate it to you guys in a timely manner. So I believe you all are with Precinct 1, and I'll send it to Jonathan for you guys to have later on. We'll again want to thank Dr. Fisher for joining us today. Just to let you know, a couple of upcoming events. We have Healthy Aging, Alzheimer's Education, and the focus will be on our caretakers. This will be actually in the Acres Home area, at the Greater Commission Missionary Baptist Church on March 30th. Okay, this is a really, really good seminar because, again, healthy aging is very, very important to our seniors, and we want to make sure that the caregivers and our caretakers are well informed on the support and resources out there for them. And then in April, we have our Clinical Research and Engagement Conference, which will be April 20th. Just yesterday, just to give you a little background, yesterday we had what's called a Community Engagement Studio. And the topic was on clinical trials, if African Americans will participate in clinical trials. And we had a very, very, very good discussion about it. And thinking about it is, science professionals will say that African Americans don't participate in clinical trials, and it goes back to Tuskegee, educational Tuskegee, mistrust for medical professionals. So we want to hear from you. We also want to educate you on clinical trials, the importance of clinical trials and how it helps our community. So we'll have information, and again, I'll send it to Jonathan and our other collaborators. I'll let them know when this conference is coming up. So the Community Engagement Corps, we are almost at the end of our fiscal year, so May 2024 is going to be our last conference for this year. And then again, we'll be sending out information for next year for the topics. So beginning last June, we started off with kidney disease. July was respiratory disease. August was immunization awareness. September is prostate cancer. October is breast cancer. November is healthy cooking, eating, and drinking, which focus on diabetes care. December is childhood cancer. January was a big event, which was the maternal and child health seminar. February, which we're in now, is our autoimmune disease, which is focused on lupus. March will be healthy aging. April is clinical research and engagement. And finally, May 2024 will be self-care and emotional well-being, which will be targeting mental health awareness. So again, that information will be sent out to you guys, and we hope to have you for that as well. Any questions before we depart? So we truly appreciate your time today. We truly appreciate your participation and your willingness to listen, and we look forward to serving you in the future. Absolutely, yes, ma'am. Yes. Most likely, because that is on a Saturday, you'll have to. Yes, ma'am. Provide, but if the community center, if they provide transportation, we definitely welcome it. But yes, ma'am. And anyone else? Any more questions? Okay, guys. We truly appreciate your time. You guys drive safe. If you haven't visited our tables already for the information, please visit the table, take information. Also the magazines, things of that nature. You guys have a wonderful evening. Thank you.
Hello, and thank you so much for joining us today. My name is Dr. Veronica Ajewale. I am the Director for the Community Engagement Corps here at Texas Southern University. We want to say a big thank you for joining us for today's program. We are sure that you have had a lot of great information that is going to help us together as a community in addressing health disparity. Please feel free to share your comments with us, complete our survey, and most importantly, follow us on our social media pages. Our social media handle is CECTX Southern U. Again, we want to say a big thank you for joining us today, and we hope that you continue to connect with us. Thank you.